Cardiogenic shock is not just another topic. It is a very serious, life-threatening cardiac emergency. Something very important about shock that you should know. Shock is lack of perfusion to tissues. Cells are not getting the oxygen they need, and if the issue is not reversed, organs will begin to fail. If you think about the causes and management of different types of shock, they are not the same. However, the way the body will react to each specific type of shock may look alike. What is cardiogenic shock? Cardiogenic shock is what happens when there is a problem with the pumping ability of the heart. And that problem has led to a serious decrease in cardiac output. The heart has failed as a pump, and the consequences can affect the whole body. Remember, the heart is the one that pumps blood to the rest of the body. And now it is not able to do that effectively. Cardiogenic shock may be caused by myocardial infarction, cardiomyopathy, or severe pulmonary hypertension. The left ventricle is badly damaged, and the result of this failure include decreased cardiac output and poor tissue perfusion. The patient goes into a shock because there is impaired cellular metabolism. NGA step 1 is recognize cues. So you should be familiar with the classic signs and symptoms of cardiogenic shock. Tachycardia is the first sign of shock, and this is common with all types of shock. Cardiac output is going down because the heart cannot pump, and the patient will have hypotension and tachycardia. Fluid is backing up to the pulmonary system, so there will be crackles in the lungs, and this is also the reason patients have shortness of breath. Patients will have increased respiratory rate, cold clammy skin, and altered mental status. All of these are due to decreased organ perfusion. You know what else you will see in cardiogenic shock? Decreased urine output. It is usually less than 20 milliliters per hour because the kidneys are not being perfused. As the problem continues, the patient becomes agitated, anxious, and restless. Take a look at this question. This is practice question 1. The nurse has received report on these 4 patients. Which patient should the nurse assess first? Answer choice A, patient with heart failure who is waiting for discharge instructions. B, a post-MI patient with blood pressure of 78/42 and is confused. C, patient with chest discomfort rated 2 out of 10 waiting for echocardiogram. D, patient receiving IV antibiotics for pneumonia. Which of them will you see first? The correct answer is B, a post-MI patient with blood pressure of 78/42 and is confused. This is the rationale. The patient is having signs of cardiogenic shock, hypotension, altered mental status, and recent myocardial infarction. These are signs of a life-threatening emergency, and immediate intervention is required. Look at the patient in answer choices A, C, and D. They are in stable conditions. So, what is the biggest complication in cardiogenic shock? The priority health problem is pulmonary edema. That's not the only complication. If the problem continues and organs are not getting blood supply, the result is multi-organ failure. Let's talk about the management of cardiogenic shock. The patient will be admitted to the cardiac critical care unit, and treatment will focus on improving cardiac output without worsening fluid overload. Oxygen and the ABCs are the first priorities, and the patient may need ventilator assistance. Medications will be ordered as well, and this will include dobutamine to increase the heart pumping ability, vasopressors like norepinephrine to help increase blood pressure. Diuretics will be there too to reduce fluid overload. Aside from medications, patient may need advanced support. Intra-aortic balloon pump may be used to reduce the heart workload and increase perfusion. The patient with cardiogenic shock is in need of close monitoring, so nursing interventions must be put together to ensure positive patient outcomes. The first thing to do is to check the ABCs, airway, breathing, circulation. Monitor vital signs, level of consciousness, and peripheral pulses. You must monitor patient closely for signs of worsening fluid overload. Monitor urine output, BUN, and EKG rhythm. Be very careful about IV fluids because cardiogenic shock is not a fluid problem. The primary problem is that the heart cannot pump. Monitor patient activity levels and check their tolerance by looking for stable heart rate, blood pressure, and respirations. Administer medications according to doctor's orders. This is practice question 2. The nurse is caring for a patient with cardiogenic shock who suddenly develops crackles, severe difficulty breathing, pink frothy sputum, and oxygen saturation of 80%. Which complication is the patient most likely experiencing? Answer choice A, pulmonary edema. B, pulmonary embolism. C, pneumothorax. D, atelectasis. Which of them will you select? The correct answer is A, pulmonary edema. This is the reason why. When the left ventricle fails, blood will back up into the pulmonary circulation, which will lead to pulmonary edema. One of the specific findings in pulmonary edema is pink frothy sputum. The other answer choices are not correct. For patients with cardiogenic shock, you will always focus on oxygenation and perfusion. This is practice question 3. A nurse is caring for a patient admitted with an acute myocardial infarction. 2 hours later, the patient becomes restless and reports extreme shortness of breath. Here are the assessment findings. Blood pressure is 82/48. Heart rate is 108 beats per minute. Respiratory rate is 30 breaths per minute. Oxygen saturation is 88% on room air. Skin is cool and clammy. Which of the following findings strongly indicates that the patient is developing cardiogenic shock? Answer choice A, restlessness. B, cool clammy skin. C, hypotension. D, tachycardia. What do you think about this one? Place your answer choice in the comment section. Thanks for watching and learning from this video. Subscribe to this channel for more lessons on cardiac emergencies. If you have any questions, you can place them in the comment section. See you next time.